The doctor is in.
Hi guys, it's Dr. Sal from DrSecrets.com. Thank you so much for joining in. Today we're going to take a look at chlamydia infections in men and women. Chlamydia is a sexually transmitted disease, and in this section I'm going to talk to you about diagnosis and treatment. It is preventable. It's also very easy to treat if acquired. So we're going to start off here with this fictionary character called Chris, and he comes in a lot of distress. He comes in and tells me he hates having to see doctors, but things have just been real dire for him lately. He's a college student, and the first thing he's noticed is that there's some snot coming from the tip of his penis after he pees. The other thing that he relates to me is that he wasn't sure whether he should come and see me or call the fire department, because he said every time he pees, his junk burns so badly, he wasn't sure what to do. Luckily, he came to the right place. So immediately, based on his age and the symptoms that he's describing and the fact that he's in the college peer group, I immediately suspect that he has an STD. So I also ask him with his partner, does he use condoms? He replies no, he likes to go bareback. So I get a pee sample from him to send off to confirm my suspicions, and I start him on a prescription for an antibiotic called Zithromax or azithromycin, and tell him on the way out in future, if in an unstable relationship, to practice safe sex using condoms or barrier protection, basically. Also to abstain from any future intercourse for a week, and to also inform any recent partners to come in and get tested for themselves. So that's it in males. It's really simple. It usually burns like crazy. It's obvious to them that there's something wrong, and they usually go and seek attention. In females, on the other hand, the story is a little different. So across town, this is Kathy. This is his partner, and they ain't speaking no mo. So she never got the memo from him that she's probably infected as well. The problem is that in women, half to 3/4 may have absolutely no symptoms. So it may only turn up if a past partner calls and lets them, informs them that they're infected, or it may turn up on routine screening, either as a STI check or STI just stands for sexually transmitted illness, or during a routine pap test. So she's a sitting duck here. She doesn't even realize that she's sick. So during her pap test a few months later, they see these cells here on testing. As you can see here, there's like a normal cell here, but what is this? This is a zombie cell full of this pathogen, the chlamydia. This is a worst case scenario look at it. There's actually pus coming out of the cervix here. And I'll show you what a cervix is in more detail in another slide. But again, in most cases, don't expect to see all this, because most cases, or at least half of cases, for females, there's absolutely no symptoms at all. That's what makes it a little tricky and scary. So in this slide here, what you can see is this is the vaginal opening here, and right at the tip here of the womb is a doorway or a portcullis called a cervix. What this is trying to demonstrate in this slide is that this chlamydial infection in females, especially since it's so quiet and indolent, can cause inflammation deep inside the reproductive tissues. So in this case here, this chlamydia has gone up into the fallopian tube here and has affected it. So that can cause scarring, which can then cause later infertility, because the eggs popping out the ovaries here can't get down into the womb here for fertilization. And it can also cause ectopic pregnancies, because the egg, when it pops off, comes down the tunnel here, it may get arrested by scarring before getting into the womb. So you may end up with the sperm coming up in here, meeting the egg here instead of here, and causing a tubal pregnancy, or what we call ectopic, which is quite painful and frustrating because you have to take the tube out. So that's why in females, chlamydia infection is probably more important. There's an asymmetry to it. It's not as severe for males. And this other scenario here where it goes into the deeper structures is sometimes also called pelvic inflammatory disease. Again, it is definitely treatable. You take the same single course of zithromax, or also called azithromycin as with the guy Chris. It's 1 gram taken all at once by both partners, and avoiding intercourse with them or anyone else for a magic 7-day period. This down here is just a graphical illustration of what the chlamydia looks like. I don't even believe that chlamydia really looks like that, but it's just an illustration of what the pathogen might look like. So, oh, and the other thing is remember that it's a STI that can be interrupted. You can stop it from passing by using barrier protection during intercourse. So that is chlamydia infection in men and women in a nutshell. Thank you for watching. And don't forget to subscribe so I can keep you in the loop of other videos. And have a great rest of your day.
Thanks for watching. Get notified of new videos. Subscribe now.